Hello everyone! So this time our content is about abnormal menstruation or abnormal periods. So I hope na samahan niyo po ako until the end of this. I hope na samahan niyo po ako until the end of this video. Ayan. So what is abnormal menstruation or abnormal periods? Typically, menstrual periods that last for 4 days to 7 days. Examples of menstrual problems include periods that occur less than 21 days or more than 35 days apart, missing 3 or more periods in a row, and a menstrual flow that is much heavier or lighter than usual. So, kapag mayroon tayong heavy bleeding or light, yan, irregular ang menstruation natin. Tapos, kapag less than 21 days, meron ka na naman. Or more than 35 days ka nagkakaroon. Yan yung irregular menstruation. What is abnormal menstruation? Most women have menstrual periods that last 4 to 7 days. Kasi diba ang period na normal is usually 28 days. But normal menstrual cycles can occur from 21 days to 35 days. So, ito yung mga example ng menstrual problems include periods that occur less than 21 days or more than 35 days apart. Tapos, missing 3 or more periods in a row. Nakamiss ka ng 3 or more than 3 months, diba? Or more than 3 months na periods. Menstrual flow na mayroong heavy bleeding or mayroong namang light bleeding. Abnormal din po yun. Periods that longer than 7 days. Ayan. And periods that are accompanied by pain, cramping, nausea, or vomiting. Bleeding or spotting that happens between periods after menopause or following sex. So, observe din natin to kapag meron kang bleeding or spotting in between your periods. Tapos, bleeding after menopause and bleeding after sex. Ang mga example ng abnormal menstruation, meron tayong amenorrhea. Amenorrhea is a condition in which a woman's period have stopped completely. So, absence ng menstruation, itong amenorrhea. Yan ang tawag natin sa medical term. Oligomenorrhea refers to periods that occur infrequently. Infrequent. So, dito sa oligomenorrhea, minsan ka lang magkaroon. Dysmenorrhea refers to painful periods and severe menstrual cramps. Some discomfort during the cycle is normal for most women. And another example is abnormal uterine bleeding. May apply to a variety of menstrual irregularities including, number 1, si heavy menstrual bleeding, a period that lasts longer than 7 days, or bleeding and spotting between periods or after sex or after menopause. Ano yung causes ng abnormal menstruation natin? Number 1, stress and lifestyle factors. Ayan. Si stress, ayan na naman. And lifestyle, yung mga sedentary lifestyle natin. Gaining or losing a significant amount of weight. Ayan. Dieting. Kasama yan dyan sa factor na yan. Changes in exercise routines. Travel, illness, or other disruptions in woman's daily routine can have an impact on her menstrual cycle. Birth control pills. Most birth control pills contain a combination of the hormones estrogen and progesterone. The pills prevent pregnancy by keeping the ovaries from releasing eggs. Going on or off birth control pills can affect the menstruation. That's another cause of irregular or abnormal menstrual cycle is uterine polyps or fibroids, endometriosis, pelvic inflammatory disease. Ang pelvic inflammatory disease is a bacterial infection that affects the female reproductive system. Number 6, polycystic ovary syndrome, yung may mga PCOS. Ayan, another cause yan ng ating abnormal menstruation. Number 7, premature ovarian insufficiency. Ito namang premature ovarian insufficiency, nangyayari ito. This condition occurs in women under age 40 whose ovaries do not function normally. This menstrual cycle stops similar to menopause. Other causes is uterine cancer or cervical cancer, medication such as steroids or anticoagulant drugs, medical conditions such as bleeding disorder or thyroid, overactive thyroid gland, or pituitary disorders that affect hormonal balance, and complications associated with pregnancy including miscarriage or an ectopic pregnancy. How is abnormal menstruation diagnosed? Paano dinadiagnose ng mga doktor daw po ito? Number 1, blood test to rule out anemia or other medical disorders. Vaginal cultures to look for infections. A pelvic ultrasound exam to check for uterine fibroids, polyps, or an ovarian cyst. An endometrial biopsy in which a sample of tissue is removed from the lining of the uterus to diagnose endometriosis, hormonal imbalance, or cancerous cells. Tinitreat ang abnormal menstruation. Number 1, nire-regulate ang menstruation cycle. Hormones such as estrogen, yung progesterone, might be prescribed to help control the heavy bleeding. Number 2, yung pain control. Mild to moderate pain or cramps might be lessened by taking an over-the-counter pain reliever. Ang uterine fibroids naman, yan, tinitreat yan by medications or by surgery. Endometriosis naman, minamanage yan by over-the-counter prescription of pain relievers. It may help to lessen the discomfort. Pag-usapan naman natin ngayon ang prevention ng abnormal menstruation. Ayan, paano natin maiiwasan or paano natin mare-reduce ang pagkakaroon ng abnormal na menstruation? Number 1, of course, we try to maintain a healthy lifestyle by exercising moderately and eating nutritious foods. Ayan. You make sure that you get enough rest.
Practice stress reduction and relaxation techniques.
Use birth control pills or other contraceptive methods as directed. Directed, ibig sabihin po may gabay po ng isang doktor. Ang pinakalas natin na prevention or para ma-reduce natin ang abnormal menstruation is to see a doctor for regular check-ups. Yun lang. I'll see you again on my next content. Ingat po tayo parati kasi meron na tayong nakita na lambda variant dito sa Pilipinas. 1 OFW, 35 years old female, galing sa ibang bansa. So mag-ingat po ang lahat and I'll see you again on my next content. Please do not forget to like and comment down yung mga suggestion nyo or yung mga komento nyo para sa content natin ngayon. And I'll see you again on our next content. Bye po!